Hi, my name is Jasmine Lord, and I am doing this presentation for Psychology of Health and Illness at Florida International University on the placebo effect. So first, let's talk about placebos versus medications. A placebo is known as something that is harmless, a pill, medication, or procedure that is prescribed more for the psychological benefit to the patient rather than the physiological effect that it has. There is no proven therapeutic effects of placebos, and they are used as controls in testing new medications. Medication or surgery, on the contrary, is used to cure a disease, given to treat a medical condition, or given to actually relieve a symptom of an illness that it has been proven to be successful at treating. Here are some examples of the placebo effect in action. These are just examples from different studies that were taken over time. Of course, inhaling a placebo drug improved lung function in children with asthma by 33%, although the placebo had no proven therapeutic effect on lung function. Being exposed to fake poison ivy caused a rash. Obviously, fake poison ivy would not have an effect on the skin, but the psychological fact that they believed it was going to be poisonous and cause a rash, it did. Balding men took placebo and increased hair growth 42% of the time. And sham or fake knee surgery reduces pain just as much as real surgery, majority of the time in patients. So these are some examples of how placebos can actually work on helping the patient feel better. So how do placebos work, you ask? Expectations play a huge role in people believing that their condition is improving. And this is an important thing to remember, that even if you're taking a successful medication that has been proven to have a therapeutic effect, the expectation that you'll get better is very, very important in you actually getting better. So first, the patient will experience some pain. Then the physician will prescribe a placebo painkiller, and they will tell said patient that this particular painkiller will start to decrease their pain within an hour. The physiological effect of the placebo will actually stimulate some of the time release of the body's natural painkillers. In a functional MRI, it revealed that when patients reported reduced pain after their placebo, they also showed decreased activity in the pain-sensitive regions of their brain, which shows that although the placebo had no therapeutic effect, it actually had an effect on their pain. It's important to remember that placebos also affect marketing majorly. The power of the placebo response is strong enough to have affected the way that the drug market operates as a whole. No drug in the United States can be marketed unless it has been evaluated against a placebo to make sure it is effective. Evaluation is done by a double-blind experiment in which the experimenter and the participant have no idea whether or not they're receiving the placebo or the actual drug. This is good for us to ensure that there's no bias and we are receiving accurate results. Then they take the difference between the drug's effectiveness and the placebo's effectiveness, and they determine the accuracy of said drug based on how effective the drug was over the placebo's effectiveness. And then the drug will be released to the market for use. Here are my references. Thank you for listening.